Y'all remember those Wrap It Up commercials that would play on BET in the early 2000s? Everybody from Monique to Jamie Foxx to Boston's very own Free Marie encouraged people to practice safe sex and get tested. At the time, it was the largest public education effort on HIV/AIDS directed at Black people. Fast forward to today, HIV is no longer considered an automatic death sentence, thanks to medical advancements that can suppress the virus and prevent its spread. One of them is PrEP, or pre-exposure prophylaxis. It's been a game changer for people who have a higher risk of exposure to HIV. Now, when we think about who that population is, certain people may come to mind. Men who have sex with men, or people who share needles. But in reality, it's anyone having unprotected sex or who has untreated sexually transmitted infections, which means maybe it's time to rethink who should be taking PrEP. One thing that's always gotten in the way of sexual health is stigma. It makes conversations like these seem taboo or shameful and keeps people from receiving preventative care and education. Pair that with limited awareness and access to sexual care, and you have health disparities that intersect with race and gender. For instance, despite Black women accounting for 57% of all new HIV diagnoses, they only make up 1% of those prescribed PrEP. During the initial rollout of the medication, the medical community's focus was largely fixed on men who have sex with men, often leaving Black women in a blind spot. And these days, we don't have any celebrity-endorsed commercials driving the discussion. So if this conversation isn't normalized, how do patients get the safe and affirming care that they deserve? We know the problem. Now let's get to the root of it. I'm Paris Alston, and this is Rooted. Black women are at a disproportionate risk for contracting HIV, but they're rarely talked to about something like PrEP. We spoke with Dr. Whitney Irie, who's a researcher at Washington University in St. Louis, about the effectiveness of PrEP for this population. So we are no longer necessarily in the days, right, where HIV was what some would consider an automatic death sentence. But help us understand how severe the risk is to Black women right now.
Yeah, you're right. So HIV is no longer a death sentence. Folks are living long and prospering and healthy with, the support of biomedical treatment, and also largely undetectable as well, which is also just fantastic, right? However, we still know that Black women are disproportionately burdened by new HIV infections. And this has been persisting for decades now. There's been a little bit of a drop in incidence rates, which is great. However, we're still more likely than any other group of women to have a new HIV infection, and that's something that we have to really grapple with. And part of grappling with that is understanding and addressing the complexity that is being a Black woman and holding your sexual health in the United States. And so those are the type of things that my work attempts to understand, appreciate, intervene, and, advance for Black women in the U.S.
And say more about that. Why are we at more risk?
So Black women in the U.S., Black cisgender women, are more likely to become HIV infected through heterosexual contact. And for a lot of Black women and a lot of women living with HIV, believe it or not, HIV was their first STI. And so what we have here is this kind of almost like a paradox where it's not necessarily this risk behavior or risk algorithm. It really comes down to sexual networks and who you are engaging with at what time. And so the reason why these rates have persisted is because for the longest time, HIV research has focused on behavior, has largely focused on behavior. I mean, we used to have a Center for Disease Control and Prevention, the CDC, had a EBI compendium, right? So EBIs are evidence-based interventions. And all these interventions that have been approved by the CDC and federally funded and all these things, and 97% of them, if not all of them, focused on behaviors. And what we saw is what we see today is that it's not behavioral activation that necessarily is going to drop the rates for Black women. It's better understanding their sexual context that they're in and how we can ensure that we are advancing our interventions from the individual level to more of the social, community, and policy level. So Black women, from my research and my viewpoint, their vulnerability to HIV in the US is largely determined by their zip code. And so if you are in a high prevalence area where other subgroups of those who are more vulnerable to HIV, for instance, like men who have sex with men, trans folks, those who use injection drugs, you are more likely to be embedded in a sexual network, even if you're keeping your numbers low, even if you only got a couple of partners or one partner. That alone, being in that vicinity, in that context, actually increases your risk. However, you might not have known that. Other folks watching this may not have known that. It's because the education has not rolled out about that, largely because the interventions have not caught up to that reality. And so that's what a lot of my work does. It really focuses on these kind of social and contextual conditions that make Black women much more vulnerable.
And so one of those interventions, of course, is PrEP. And it's become more widely used in recent years.
Yeah.
What are the benefits of Black women using PrEP?
Yeah, you know what? PrEP is pretty amazing. So PrEP is this pre-exposure prophylaxis, a medication that you can take, and there's different modalities, right? So you can take the daily pill. There's even some efforts to make it such that you don't always have to take the daily pill. It can be event-driven. So you're just like, okay, I'm going on this cruise. I'm going to take a few pills. I just want to make sure I'm safe. I'm keeping it cute. There's also injectable PrEP. And that can be twice a year. And there's also some 3 or 4 times a year as well. So there's different modalities. There's also the ring that's coming down the pipeline and some dual prevention ones. So dual prevention being prevention of pregnancy as well as protecting folks from HIV. And so there's this suite of options when it comes to the biomedical pipeline. Like, it's happening, y'all. And so the reason why Black women can benefit from it is because, as I stated, there's no risk algorithm for Black women. This is an opportunity to be vigilant about your sexual health because you don't know what you don't know. So it's like, I'm being committed, I'm in a monogamous relationship. However, I'm not very sure about my partner's status or what my partner's doing. Or maybe we have a little situation where we don't talk about what we're doing, but we're happy with what we got with each other. And so it empowers Black women to say, you know, my situation is unique in this way, and I still want to be vigilant. I still want to be protective. So I'll start taking PrEP, and if it suits my lifestyle at this time. So it has this ability to be responsive to the seasonality that sex is, right? So everybody has their sexual seasons, whether you're going to be booed up during the winter or you having a hot girl summer, you just kind of have these seasons, and PrEP can be responsive to that and can significantly help very, very young Black women who are exploring their sexuality and sexual practices and things of that sort. And even my aunties, even, everyone else who are older, it plays well with where you could be in your life when it comes to sexual activities, which means that you can be protected, and it significantly reduces your vulnerability to HIV.
And so are you saying that Black women of any age can take PrEP?
Yep, sure can.
Very interesting. Very good to know. Now, you did mention that earlier that in many cases, Black women have been susceptible to HIV because of heterosexual relationships. And immediately, Dr. Irie, I think that a lot of people's mind goes to the myth of the DL man, right? Running around, having a hot boy summer or whatever it may be, and not being transparent with their partner about what they're doing, about what their status is. So is it more complicated than that? Are there more layers?
There's absolutely more layers, and the myth of the DL man, is part myth and part reality. And the reason why it's partly reality is because in the Black community, there's such fierce homophobia. Like, it's violent homophobia in the Black community. So men who enjoy having sex with women and who enjoy having sex with other men are largely just highly stigmatized and completely, afraid of what it can mean to really kind of disclose and kind of talk about their sexual preferences. And that's real, and that's a reality. And so that is part of it, correct? And also, we know that for Black women, it has been shown, Dr. Ada Adamora out of UNC, she passed away a few years back, but a brilliant, amazing Black woman, infectious disease, HIV prevention researcher, showed in her sexual and social network research that Black women largely prefer partners who are racially concordant. So right there, we already know that when it comes to sexual partnerships, Black women's preference pool is going to be largely Black men. Now let's layer this on with another social reality. A lot of Black men are largely vulnerable to incarceration and having to navigate carceral settings, which further complicate, their behaviors, whether it's injection drug use, whether it's sexual behaviors. It adds another dynamic. And so we're seeing concurrent partnerships highly prevalent in Black communities. And concurrent partnerships are just what you're thinking. There's a male and they are having their pick of they in the candy shop, honey. They could date this person, things of that sort. Sexual concurrency is very high in the Black community for a lot of reasons, right? The sex ratio, there's far more men than women, and also we see the carceral rates and things of that sort. So it kind of brings in this added element, in addition to the reality that, Black men could very well only have sex with women. However, the woman they're having sex with, we don't know who her partner was having sex with. And so this is where that network comes in, right? So you see those nodes, and it's just like, well, it wasn't me, it was my partner's partner. And that's how that transmission happened. And that's why we see incidence rates and also diagnosis rates concentrated in specific settings. So, we might see, and I'm not trying to stigmatize these settings, I'm just describing, we might see in the HIV epidemic hotspots like DC, Miami-Dade, Atlanta. You're just thinking, why does it feel so concentrated? It's because there's a sexual network interaction happening here where it might not have been me. I was faithful to you, however, the partner's partner, was living with HIV, and that's how the transmission occurred. And so we're dealing with these very kind of complex and nuanced sexual networks when it comes to Black communities across the United States, whether they're in the South, whether they're in the Midwest, whether they're in rural settings. There's just something that we have to better understand and appreciate about being a sexual Black person in the United States.
Mm-hmm. Now, I mentioned that PrEP has become more prevalent. The use of PrEP has become more prevalent in recent years. And in fact, between 2023 and 2024, use increased by 17% to around 590,000 people. Mm-hmm. And I hear everything that you're saying, Dr. Irie, but I wonder for some women, if they're hearing this and they may be saying, well, why do I have to take it, right? Especially if we know that the majority of PrEP users are men and it's heavily marketed towards men. Why is this suddenly my responsibility too?
Oh my goodness. I'll be like, sis, I got you. I completely understand. I think that the pill burden and the protection burden being on women, I think is highly inequitable. I think it's completely unfair. And I would never take that angle when it comes to engaging Black women about PrEP. Because for me and my work, it's not about driving the numbers. It's about knowing that you have an option. So you know what? I'll say, boo, you absolutely don't have to. But what I need for you to walk away from this conversation is if you're feeling like, I'm not sure. Ooh, I saw some text messages come up, or I'm just feeling like maybe I want to be more protective. You know what you can get, where you can get it, how much it's going to cost, and how long you need to be on it. And that's what we need to be emphasizing with PrEP. Black women, they do not have to take PrEP. However, if you feel like you're having a challenge navigating condom use, okay, you asking for it and they're just kind of like, doing a dodge, you feel like you have some challenges because you may have had an STI diagnosis and it keeps reoccurring because your partner won't get tested and take their medication. or you notice that or you're with a partner who was a previous injection drug user. You're not judging, y'all are walking this journey together, but you just want to be protective while they go through recovery or while they're kind of safely using and things of that sort. That PrEP is an option. Know that PrEP can be an avenue for you to be more protective about your sexual health. You see those numbers, and those numbers are definitely driven by folks who are very close to the epidemic, folks who see this, in their space, in their day-to-day, and that's largely men who have sex with men and trans folks. However, for women, it feels a little bit distant. It's like, well, I don't see this in my day-to-day. I see pregnancy in my day-to-day, and I see STIs in my day-to-day. So why am I engaging in this? Why am I putting this in my body? And you're doing this because you have a reason to, not because you're at risk, but you're sitting back and say, oh, now I have a reason to be more protective. And let that reason be the driver, not the fear of the numbers be the driver. Because the reason is going to be more sustainable. You're going to have more peace with it. It's going to make more sense. But the risk is more fear mongering. It's just kind of like, well, I guess because of who I am and my identity, I need to do this. And we don't want that. We are a better community than that. And so that's how I would approach it. That's what I think about with it.
Now, would you say that this is only a concern for Black women, or should women of other races also be considering using PrEP?
Women of other races should also consider using PrEP. And, and I want to also highlight some intersectionality here, because absolutely Black women, but we got Afro-Latino women who are still, we have non-U.S. born Black women who are in the States. We have women, definitely Latina women, across different immigration statuses and experiences, and that would significantly benefit from the opportunity to use PrEP. Native women, we see race amongst indigenous communities. So I think that all women can truly benefit from PrEP, and women who use injection drugs. Women whose partners are living with HIV, women whose partners are living with HIV and they might want to become pregnant. So there are a lot of different groups of women who could benefit from it beyond Black women.
And let's talk about the public health side of things, because obviously when you go to the doctor, right, you might say, okay, I heard this conversation on Rooted, I'm interested in taking PrEP, etc. But how equipped are medical providers who treat people with vaginas, who treat women? How equipped are they to talk to their patients about PrEP?
See, Paris, now you about to get me in trouble. But I'm gonna let you know this. This is the part I like talking about, this part, because this is where the accountability lies. So this is actually where the intervention is on the provider side, because providers to date, when it comes to Black women in the U.S. and women in the U.S. and PrEP, providers are the biggest gatekeepers. They're the biggest barriers. They experience significant amount of discomfort when it comes to engaging Black women in PrEP across care settings, across primary care settings, specialty care settings, and it is a problem. I spend probably about 75 to 80% of my research program, my day-to-day work when it comes to PrEP, educating providers. You think I'm out there in the street talking to Black women? Oh no, I'm talking to the providers, because should the Black woman go to their doctor and say, I think I could benefit from this, they're just like, aren't you in a relationship? Or I didn't see a risk assessment, or I'm not quite sure. I'll refer you to an ID doc. And as soon as that comes up, a Black woman's just like, I'm not sure if that's for me. And so this conversation in the medical and the public health space is critical. I wrote a commentary with Dr. Oni Blackstock about Be a Gardener. It was directed to physicians. It's just like, hey, we get it. You, for some reason, think that you need this clear algorithm about risk when it comes to engaging women about PrEP. And it's hard as a medical provider to grapple with the reality that it's nuanced. No, we don't have the perfect risk algorithm for women in the U.S. when it comes to HIV vulnerability. However, you still have the responsibility to speak with your patient about PrEP, especially if they initiate the conversation. And so we have some work to do with providers about becoming much more comfortable having this conversation about PrEP, which I would say, Paris, is rooted in the reality that in the US, when it comes to talking about sex in general, is so value-laden by so many different constructs that even medical professionals who are all up in the body, from the Rudy to the Tootie, they feel uncomfortable talking to women about sex. So if you can't talk
Well,
about
did they
sex,
go into the wrong profession?
that's what I'm saying. I'm just like, why are we even here?
Maybe they should have been a dermatologist. I don't
Yeah,
know.
because, you know, and it's crazy because what really is really crazy is that OB-GYNs have been my hardest setting to get PrEP rolled out in. OB-GYN has been, and I'm just like, y'all are all up in the canal. Y'all are all up in the vulva. Like, what are we really doing here? How are we not able to kind of have these conversations? And I think it's the social conditioning of what is navigating America when it comes to sex and sexual health. They're just like, well, I don't want to offend anybody. Offend? You're empowering, you're educating, you're normalizing, and they're looking to you as the experts to sit with them and have these conversations. Because they can't have this conversation with their doctors. Like, what are we really doing here? And so, yeah, absolutely. This is something that needs to be addressed on the provider level.
How much public health infrastructure is supporting that right now, especially when we consider that there have been cuts to the CDC's Division of HIV Prevention, and there could be cuts to the Ryan White HIV/AIDS program?
Yeah, no, it's highly limited. We are in a dangerous space right now. We are in a dangerous space. And because of how our nation is set up on a state level, we're seeing those disparities really widen because different states have different sort of Medicaid rollouts, down to even, we mean big P policy, some of the things that you mentioned, even down to little P policy like unionization. Nurses will be great PrEP champions, but if we're looking at Birmingham, nurses aren't unionized in Birmingham. So they're just like, no, thank you. We are overwhelmed, we're overburdened. So we're seeing this strain in human resource as a result of policy rollout that's really kind of, I'm just going to say it's significantly dismantling the infrastructure for us to provide preventative care. And so we're going to see in years to come that we're going to have to up our treatment because these rates are going to drive up. And it's very sad and it's very scary. But that's exactly what we're navigating right now.
What can be done on the community level to try to brace for that impact?
Yeah, so I think that, number one, vote. I mean, come on, because the policy is going to matter. So who you're voting into the Department of Public Health, that you need to know what's going on. You need to know who you're moving with and whether or not they are actually invested in, infectious disease prevention activities and programming and things of that sort. So that's one thing. So we have political will on a community level, and we must not forget that. In addition to that, demand. These powers that be, these policy makers and decision makers, if the demand is there, they're going to respond to it. And even taking it out of the political space, taking it into the pharmaceutical space, if the demand is there, you better believe Gilead is going to wake up because they want the monies. Viva is going to wake up because they want the monies. So you want to think about, well, who do we need to rattle up to move this forward? If communities in different forms of communities, right? If we're talking about the education community, we're talking about Greek organization communities, we're talking about religious or communities, or other adjacent philanthropic engaged kind of spaces, that those community level institutions, if they are organizing and thinking about just comprehensive health prevention, but also embedding and pulling in sexual health and HIV prevention, that's a force. That is absolutely a force. And I feel like that's what we need to do. And also support local organizations. Trust me, there's an org down the street that will happily talk to you about PrEP, but sometimes there's this disconnect between these community-based organizations, CBOs, and engaging folks that can benefit from HIV prevention or treatment education and things of that sort. And, and I want everyone to understand that threshold, we're welcoming folks to come across those thresholds. There's a whole team of people within those orgs that are trained and ready to support you, support your vision for your health and your vision for the health of the people you love.
You're reminding me of a few years ago, I was at a National Association of Black Journalists convention and went to this panel about HIV among the spread of HIV among Black women. And Mama Tina Knowles was there. She was the featured speaker because, of her, was it her nephew, right? Uncle Johnny, who died of AIDS, and the awareness that she wanted to spread about HIV and AIDS, especially to this particular audience. And I also mentioned at the top about the Wrap It Up, the BET Wrap It Up commercials that we used to see where we had all kinds of celebrities talking about it. I feel like we don't see that as much anymore, right? Which is part of the stigmatization of the conversation. But if we did, do you think that could change this?
It could. I know it could. I have this study that I did, and I'll be geeking out about my study, so I'm gonna keep it real then. But I have a study that we did where we sat down, we talked to a diverse group of Black women, so U.S. born Black women, older Black women, all the folks, and we're just like, who do you want to hear about PrEP from? And they're just like, I should be seeing it on my IG reels. I should be seeing this here. Like I want, if other people are talking about it, then it'll feel more normal to me. So there's just this need for someone who's in this kind of influencer realm to kind of help normalize it. And, I think that there's a demand for that. People respect those who have a platform kind of just chatting about it. Ain't saying you got to be rah, wear a t-shirt, but, integrate into the conversation. We sexual folks, y'all could be sexual about everything else. You could talk about prevention. And
facts. And they get real explicit.
I'm just like, well, we already here. So why not just sprinkle this in? We here already. And so I know for a fact, hearing that from other Black women, sitting across from them and listening to them say that, I'm just like, absolutely, you're right. So yeah, there is a demand for that, and it excites me. I think Tamar Braxton recently talked about PrEP. There were some other folks that talked about PrEP, and the extent to which they have like the influence pull and who they're able to kind of engage in that way, it makes a difference, of course. But I think the more folks talk about it and normalize it, especially when they have a platform, it's what's going to do it.
Well, that's a great segue, Dr. Irie, because I'm wondering if you can leave us with a suggestion for a Black woman who might want to have this conversation with her partner. What's the sexiest way that she can do it?
Oh, sexiest way? Oh, I'll say something like, y'all might not be able to air this, but I'll say something like, I know you don't like condoms and you want to bust all up inside me, but you know what we're going to do? Just so that we can be free, just so that all the juices can be flowing, let's just get on PrEP. I'm going to take the pill, and then you can feel all of me, and I'm going to be able to feel all of you. I'm already on the ring or IUD, so we ain't got to worry about no babies. I just want us to be enmeshed. So what's up? You're going to be like, I got that whoa there. I'm just saying, you got to like, that's what they want. That's why we're here, because they don't want to wear a condom. Ain't nobody want to wear a condom. So that's how you get them. You say, I know you don't want to wear a condom, so how about this? And they'll be like,
let's be enmeshed and entangled.
That worked. I see your producers over there sweating. It's cool. Y'all know what's up.
Oh, well, Dr. Irie, this has been wonderful. I really appreciate you being so honest about this. I think that's a key part of the conversation, too. So thank you.
Thank you for the opportunity. Always happy to. Just let me know if there's anything else I can do for you. I'm so proud of your platform and everything that you and your team does. It's just amazing. So thank you for holding us down.
A big thanks to Dr. Whitney Irie for her insights on how both medical providers and Black women can open up dialogue for preventing the spread of HIV. That's it for this episode of Rooted. Be sure to keep up with us on our social channels. And until next time, stay rooted, stay sexy, and as always, stay tuned.